to Jeve. I forgot to introduce myself, but my name is Maria and I'm based in the University of Birmingham. And I've been involved in the study as well, working with Jeve. Jeve, if you want to start by introducing yourself and then provide a quick summary of like data collection, and then we can go to the questions.
Great. Hi, everyone. I'm Jeve. I'm based in Exeter, United Kingdom as well. So today I'll talk through some of the key parts of the projects, and hopefully we'll make it clear how to upload data and achieve a data completeness in your study. So I think it's best to start in the kind of the main hub of the study, which is the Global Surgery Unit website, which includes the MAGPIES study site. So you can find it under the projects tab in this website. And once you're here, we have kind of a good spread of important parts of the project. We had a registration link, which is now inactive as we are in the data collection end stage. In terms of the available sections here, they are quite important, so you can read the background, aims, study design information. However, the key part of this is the study documents, which of course includes the most important document, the protocol of the study, but we also have the case report form where you can collect data, and I'll talk through that in a bit. Inclusion and exclusion criteria document, supporting letter from the University of Birmingham, and the visual abstract for the study. Once you've registered your center, you will receive the case report form as well as a data collection link. And I'll talk through what you do once you kind of enter the data collection form on REDCap. So all the data is collected on REDCap, which is anonymous as well. You have some information here on the background of the study. The key bit here is the kind of definitions of the study. So we have information of what kind of procedures and surgeries are included and what are excluded, but also the key definitions of, for example, what defines an adult, so patients over the age of 18, what defines emergency and elective surgery. And since we are collecting data based on the body regions, it also includes the information of what kind of areas of the body would be included in each of these regions in the study. And the inclusion and exclusion criteria document is also available here. Once you open that, it's essentially a document that has a list of procedures that are included in the study. However, there's also a list of things that are excluded, and I think that's important to take into account as well. If you have any questions about the inclusion-exclusion criteria, you feel free to email the MAGPIES Gmail account, and we will get back to you within a couple of days to help with inclusion-exclusion. And next we have the study approval from the University of Birmingham, which is the kind of approval of the study locally in the UK, and that should help you get your local approvals within your hospitals. And I'll talk about that a bit more detail in a second. We also have the data collection spreadsheet, which is essentially an aid for you to keep track of the procedures that are being done in your hospital. So once you open the spreadsheet, it is an Excel spreadsheet, so quite easy to use. We have a split between adults and children, and then we have elective emergency procedures and different areas of the body as discussed before. And the days are here. And essentially each day you should collect the number of procedures that were carried out in your hospital in each of these areas of the body, in adults and in children. A really important thing to mention here is that if there were no procedure carried out in this area of the body on a certain day, it's really important that you write a 0 in that line rather than leaving it empty, because that will affect your data completeness, and it will not be accepted as a complete data set to the study. So once you have filled all these lines, you will have a total number of procedures in this area of the body, and you can use that to continue filling this form once you have all that data collected. There's also really helpful data collection video, which essentially goes through the things that I'm talking through now. So if you need a refresher, it's available to you there. And once we get to the bottom of the form, you are asked to provide a local approval for the study. And so it is important to note here that it is not the approval from the University of Birmingham that is required here, but the local approval from your institution. So once you say that you have gained approval from your study, from your local hospital, it will be asked to upload it here. And it's a simple uploading process of choosing a file. And I have a... Sorry?
Can I just query that? So I'm the lead for one hospital, but I'm also the provincial lead for a group of government hospitals in South Africa. We got permission from our head of health and from the university for a province-wide approval. So there's one approval for all the hospitals in KwaZulu-Natal, South Africa. Each of the hospitals will be required to upload that certificate, or just one of us?
So to continue completing the form, you will need to upload an approval here. So you can all upload the same approval if it applies to all the hospitals.
That's fine. I have sent it to them. Thank you.
Yeah, great. So since I uploaded a document here already, the next step is visible. However, it will not be visible if you haven't uploaded the form here. And next, we will be asked to confirm if you've completed kind of all of the 4 steps. So you've gained the ethical approval, you've read the study definitions that we talked about, you collected all of the procedures, all of the operations that occurred within the 14-day period, and you have email and or SID ID of everyone who has been involved in the data collection. Once this is all ticked, you can select a hospital for which you're collecting. And your email should come into this line here. And the last bit is essentially transferring what you have on your Excel sheet onto the data collection form. So you have the first day of your data collection, the last day, which should be a 14-day period here. And then you put in the total amounts for each of these sections. So, and then the total appears here again for you. A really kind of good part of this form is if you have any relevant details to add about the missing data, for example, or just in general data collection within your hospital. So for example, if your hospital doesn't carry out any pediatric surgery at all, it would be a good place to write that here for us to better understand how your data was collected and kind of what are the limitations within the data possibly. And then you can submit the form here. So this is essentially the data collection. It's hopefully quite straightforward for you. And I think we're happy to take any questions from this point on.
Thank you very much, Jeffe. I think you did provide a very good summary. I would just add that the collaborators detail will only show up when you fill all the spaces in the red cap. So for instance, even if there's no operations conducted in a certain group, please do insert 0, because otherwise it won't allow you to enter collaborators details. So once you have all filled out, then a new section will come through, which will be for you to add the emails and the ORCID ID for all your collaborators. Then I'm just checking the chat box. The approval, if it needs to be translated. No, it can be the original one. It doesn't need to be translated. So if the approval is in your local language, French or any other language, it's absolutely fine and you can upload that. This is more for like our ethics committee in Birmingham asked to collate all the approvals. So it's just for that regards, basically. Martha?
Good morning. I would like to know how many weeks we could wait to get the approval. I am beginning the approval process to in my hospital and my university, so it would take around 3 or 4 weeks. It is possible to be part of the study for that time?
So that is a very good question. So the planned date for finished went data collection
Yes.
said it would be 15th of March, but we would open exceptions on an individual case basis. So
Okay.
if you would need, for that, you would need like a different link. So if you could email us with that information, then we will be
Okay.
able to get in touch with you if that's okay. I will put the email here in the chat box
Okay, thank
to be
you.
easier.
May I make a suggestion? If people are struggling to get their ethics approval or delayed ethics approval, they mustn't think that they have to then do it prospectively. It's a retrospective 2 weeks, so they can pre-choose their date range, and it's very easy then to get that information as soon as they get their approvals, even if the approval is late.
Yeah, thank you very much for your suggestion, and that's definitely a possibility. Yeah, and that can be very helpful. Oh, I see another question in the chat about, do we just need to enter the total number of cases for a particular area of body rather than the actually surgical procedure? Yes, that is correct. And the different body regions are defined in the first part of the RADCAP and are defined in the protocol. It's all the same. So, for instance, a liver surgery would be counted as the same as a stomach surgery, for instance. So, yeah, we are not asking you for the surgical procedure itself. We are just asking the numbers per body region.
Yeah, and when we submit them on the REDCap, it's the totals that we're submitting, not the per day, yeah?
Yeah,
Yeah.
exactly. It's the totals. So that last row of the spreadsheet should be the one that you would insert in RADCAP. Okay, I don't know if there is any other questions.
I was just going to say, would it be useful to go through the collaborator bit as well on the form?
Yeah, if do you already have it?
Yes, yeah.
Yeah, sure.
So just to finish off, once you fill in all the procedures from the last row, so the total row in the Excel spreadsheet here, you have a total of each of these categories as well. And then another part appears in the submission form, and you can choose essentially the size of your hospital, so how many operating rooms are in the hospital, and that allows you to choose a relevant amount of collaborators. And then once you input the number of collaborators, you can provide their email address as well as the ORCID ID. So the first 2 lines are your ORCID ID and email, and the other ones are for your collaborators. So number 1, 2, and 3. Important part here is ensure to mention to them and do it yourself that your name, the way it is spelled within your ORCID account will be the way their name is spelled on the authorship of the study as well. So it's quite important to write it, in the kind of capitalized form and correctly spelled. So yeah.
Sorry, just to ask the version or the format of the ORCID ID, do you want just the numbers or do you want the whole HTTP / etc., etc.?
So just the numbers. Yeah.
Yeah, just the numbers. And then another aspect in ORCID is that you need to set your profile name to be public. So then we can extract it once the authorship. But when we reach that stage, of course, we will circulate a PDF document for all of you to check. And usually we would run sessions dedicated to all of that, because we understand that this can be a bit challenging in some settings, and especially for people taking part first time or that have not taken part in previous studies, it can be challenging. So we will make sure to provide a series of webinars focused on that as well. Okay, I don't know if there is any other questions.
Hi, I've got a question.
Yeah.
Is it possible to send the ethics approval that you were mentioning earlier as an email, this one for us, if we can't find it on the website, for
Yeah.
us to submit from our side for our local hospital ethics
Yeah.
committee?
Yeah. Yes.
Thank you.
Yeah. No worries.
I could also send a link to the website where you can find it quite easily, I think, under the documents.
Yeah, that would be helpful as well. Thank you.
Yeah, we will update there. Thanks. Okay, I think if there are not any further questions, I think thank you very much for your participation. We really do hope that this clarified some of the questions that could be in your head. I'm sure there will be more questions once you actually fill the data. So feel free to send us an email and we will reply as soon as possible. So thanks, Yeva, for going through the whole process and for showing like the easiest way to do it. So thank you all for joining. And let us know if you need anything. Thank you. Bye.
Thanks. Bye.
Thank you. Bye.
Yes.
Cheers. Bye.
Thank you. Bye.